Hey everyone, welcome back to Your Mouth Matters. Dr. Taylor here. I know it's been a little while. I feel like we've all been so busy with summer, and I'm honestly just really excited that it's fall and we are back into our routine. I know it's been a while since you've heard from me, and I just wanted to just give you a life update on everything that's going on in, my life, but also the practice and what's coming up next. So anyways, with that said, I'm just gonna I want to share my biggest piece of personal news, which is I am pregnant. Really excited. I'm going to be having a baby boy. My due date's in February, so that's all really exciting for our family. Quinn, my daughter, is 3, and she is so excited to be a big sister, although she's pretty upset that she's not getting a little sister. She really wanted a little sister. But I think she's going to be fine. She's going to be great with a little brother. So anyways, that's really been the main reason that I've been a little quieter on the podcast. It's been such an exciting season, but I have been not feeling the best. I've been pretty tired, and between all the traveling of summer and the crazy in summer, plus being pregnant, it's been a lot. So I've had to kind of slow down a little bit, but I'm really glad to be back with you today and just to catch up and to share what's been happening, because there's been so many great things. Another big milestone in our family is that Quinn just started school last week. This has been a pretty big adjustment in a good way. I think she's really doing well. It's been such a milestone. I think especially for me, I had no idea how difficult it would be to send your child off to school. It's so hard. I don't know if it's the pregnancy hormones or what, but it's really been, I really had to talk myself up about it. And now it's happened, I feel really good. I'm really happy with the school that she's in. And, I've started packing school lunches, and so, which has been challenging to, find healthy school lunches. So if you have any ideas, moms, some good clean school lunches, I'd love some ideas. And so that's been really fun and different, and just, keeping up with everything at home. Life has been very full. But speaking of the practice, so the biggest practice news that I have is that Orthodontics is actually opening this October. Yay! So a lot of you probably know about Orthodontics, but for those of you who don't, or you haven't heard yet, so Orthodontics is my brand that treats TMJ, so facial pain, airway issues, sleep apnea, snoring, and then we also do our orthodontics, especially focusing on early childhood intervention, so treating kids early, helping develop their faces, develop their jaws, so that hopefully they don't need super extensive orthodontic treatment later. Anyways, that is going to be going in at our brand new space, which is right across the street from Green City Dental. So I'm going to be moving over there and focusing on our orthodontics, airway, and TMJ patients. To be honest, we've just been busting at the seams in our current office. So this new space is going to give us a lot of room that we need to keep growing and really to better serve our patients, because right now we're kind of on top of each other. I'm also excited with this new space. We are teaming up with Dr. Jason Scappa. He's an SOT chiropractor. Many of you probably know him or have seen him in the past. His specialty or expertise is really in treating facial pain and TMJ issues. He also works with a lot of patients that have airway dysfunction and, treats kids for early orthodontic intervention. So he's a great adjunct to what we're doing. We already work a lot with him. All of our TMJ protocols are basically, we currently work now with him. He does have a practice in Bellevue, which he will be keeping. But he will be in our practice one day a week on Tuesdays or Thursdays. And then as we grow, there is some opportunity to continue to expand as needed. So that really gives us the opportunity to work even more closely together. I'm so excited about that, especially on our TMJ patients, and really refine our protocols side by side. I think when we're working under the same roof, It's just going to be different. Number one, patients are going to be able to coordinate their appointments, so they'll be able to see him and me at the same time. There's not going to be this commute that you have to do from Bellevue with like a wafer in your mouth, so that'll be great. And then the second is that we are really going to be able to dive into more like research, especially with our TMJ and pain patients. So we've done a little bit of research now, but I think being under the same roof, it's going to be a lot easier for us to put together more data and really collaborate on our care. There's not a lot of dentists. There's really not any dentists that I know of that's really partnered with a chiropractor and they're treating patients together. Typically, patients are referred to chiropractors as needed, but there's not a lot of clinics that are doing this like integrative care model. And so I'm really excited, and I really believe strongly in that integrative model. It's so important, especially when we're dealing with the cranial bones and dealing with patients that have TMJ issues and facial pain. So that's really exciting. And for all of you who are thinking like, oh my gosh, what's going to happen to Green City Dental? So don't worry. Green City Dental is staying right where it is. Dr. Isabel and Dr. Carol are going to be running the show there and continue to provide, the excellent care that they do. I'm still very much a part of Green City Dental. I'm the owner of Green City Dental. And so I'm going to be there, like, basically overseeing all of the clinical protocols, and I really want to make sure that we're still delivering the best care across both offices with a similar mission. Many of you know, like, I haven't been taking new patients with Green City Dental because I really have been focusing my practice more on TMJ and airway, and then that early childhood orthodontics. So I've been already kind of distancing myself just clinically, but at this point, we're just kind of separating out the practices into two. But don't worry, I'm still around and I'm still here. And if you have issues, if you have jaw pain, or if you have snoring or sleep apnea, or your child needs early ortho intervention, I'm here. I'm right across the street. So I'm excited because we really get to create a clinic, or two clinics, I guess now, that really check all the boxes for all of our dental, whole body health stuff. So that's really exciting to me, and it's been such a dream. The other thing, so talking about Green City Dental, so we are rolling out some really exciting new periodontal protocols. We've really been upping our game when it comes to diagnosing and treating gum disease at the root level. So one of the things is that, we have a microscope that we use in our practice, and there are so many studies that link these bad bacteria in the mouth to other systemic conditions like heart disease and Alzheimer's and diabetes. And we are seeing these bad bacteria on our microscope all day long. And we have recommended protocols and different things. And I think we have a really good protocol now. But with some of the more aggressive things like parasites or spirochetes, or the really aggressive bacteria that are really linked to heart disease, I think we need to get a little bit more aggressive. And so we're up in our game, and I'm really excited about that because our hygienists are excited and they're on board, and we are taking it to the next level. So that's great. So we'll talk more about these changes and these new protocols on future episodes. But the other thing with that comes that we have welcomed a new hygienist, Wendy. She is new to Green City Dental. She's been training with Barbara and Vanna, and I love Wendy because she's so curious and she's very open-minded. And she really has a passion for root cause dentistry. I think she's really going to be an incredible addition to the team. And I'm really excited for all of you to meet her. So we needed a new hygienist. Don't worry, Vanna and Barbara are staying. They are not cutting days or anything like that. Like, they're staying. But I know that we have been pretty backlogged on our hygiene. So for people that need their teeth cleaned, a lot of times we're booking you, several months out, and there's just not a lot of availability, which is a great problem to have, except for if you're a patient and you're trying to get your teeth cleaned. And like I said, I really want to have a clinic where we are taking care of whole bodies, right? We're dealing with the dental issues, and to deal with the dental issues and the systemic issues and those combined things, we really have to offer more opportunities for our patients to come in and get their teeth cleaned and to have the periodontal treatment that they need. The access to care needs to be easier. So I'm excited for Wendy. She's training currently, but she will be starting to see patients at the end of September. So come say hi to her, meet her. And if you want to try her out and give her some feedback, that would be great. So just let our scheduling people know if you'd like to see her. So the other thing is that I have had a lot of different requests for podcast topics. And I love that I love when people send me requests for topics, because sometimes I don't realize like where you need more or you want more content, right? So it was great. It's great getting requests. So with that said, if there is a topic that you want me to talk about, or if there is a podcast that you feel like we need on our show, please message me. You can email info@greencitydental.com and let me know what you want to hear about. For the ones that have been requested, they are coming soon. Even though I've been quieter lately, I'm in the second trimester and I'm feeling good, and we have a lot of content that's about to drop. So stay tuned. And then before I wrap up, I just want to say thank you. Thank you for supporting this podcast, for listening, and for being part of this journey with me. I started this podcast because I wanted an avenue to be able to deep dive into certain topics with patients, and because I don't always have the clinical time to do so. We have like 50 hours of podcasts that are recorded, so it's impossible to go over all of the things with a patient, and there's just so much to go over. So this podcast has been so great, not just with patient education, but I think, people have been finding it all over the world, actually. And it's just been a really great way to get the information out and let people be their own advocates. So if you've been enjoying this podcast, I would love it if you could share it with your friends and your family. I would love to see you post about it on social media, and I would really love to see us get some more reviews. And like I said, if there's a topic that you want me to cover, please let me know. I love hearing your ideas, because sometimes I'm like, I feel like I've talked about everything. And then people send me messages and then I'm like, oh no, I haven't. So anyways, help me with ideas. So yeah, that's my update. So yeah, I'm excited. Big personal news. Baby boy coming in February, and lots of growth happening in our practice. I'm really looking forward to this next season. It's going to be a wild ride, both personally and professionally, and I'm just really thankful for all of you, and glad to have you alongside me. So thank you. Until next time, take care, and remember, your mouth really does matter. Thanks so much for tuning in to Your Mouth Matters. If you enjoyed this episode, please take a moment to leave a review. It helps more people find the show and join us on this journey towards whole body health, starting with the mouth. Make sure to subscribe so you never miss an episode. And if you found this helpful, share it with a friend or two, especially the ones who nerd out on wellness as much as we do. You can also follow us on social media at Green City Dental and O2 Dontics for updates, resources, and behind-the-scenes conversations. Until next time, breathe well, smile often, and remember, your mouth really does matter.